between Europe and Asia, economic dialogue, humanitarian missions, multi-vector cooperation and search for compromises in the world arena. How else does Kazakhstan participate in the development of the modern world? For more details, watch Kazakhstan International Vectors. Today in the program, number 1 in the world again. What is the disease of the century? What did Gene Expert do in the fight against TB? How planet will get rid of tuberculosis in the nearest decade? Tuberculosis today is ahead of cardiovascular diseases. If all the last years we have heard that the overwhelming number of deaths in the world happen due to heart attacks and strokes, the current statistics changes the picture. Moreover, among the infections killers, Bacillus cocci confidently ranks the first. Experts ring the alarm. A third of the world's population has tuberculosis bacteria. This trend is associated with the overall growth of the population, the prevalence of HIV infection, and the ineffectiveness of government programs to fight the disease. Due to the seriousness of situation, the World Health Organization declares tuberculosis a global danger. But what will help mankind to defeat it? Today, doctors all over the world have found a reason for hope. A new invention, Gene Expert machine, can reveal the presence of tuberculosis in just 2 hours, while earlier it took several months. A timely diagnosis gives 2 significant advantages. First, the doctor in a timely manner prescribes the necessary treatment, and secondly, the danger of infecting others significantly reduces. The principles of its operation are based on the polymerase reaction, or rather the real-time polymerase chain reaction. Diagnosis is carried out with this cartridge, to which the sample of sputum is being put. After 15 minutes of contact with this buffer, we can put this cartridge into the machine. In order to put it, we must conduct a barcode scan to enter the data. Then we just insert it into the Gene Expert.
In the past, it could take a long time to get your diagnosis. And sometimes the diagnosis was that, of course, you had TB and you would start treatment, but they would treat you for the normal TB, what we call drug-sensitive TB. And it was only after that 6 months of drug-sensitive TB that we realized, oh, actually this person is not getting better, and then we would have to start them on a new treatment.
According to the expert, today every Kazakhstan resident has access to the Gene Expert machine. This does not mean that a smart apparatus is installed in every laboratory of the country. However, anyone can have tests in his or her state clinic, from where the sample will be delivered to the device in the shortest possible time. Government and international organizations around the world are allocating millions of dollars to combat tuberculosis. However, representatives of WHO estimated that these funds are not enough. For research, treatment and prevention of the disease, another $2.3 billion is needed. According to the World Health Organization, in 2016, nearly 10.5 million people around the world were infected with tuberculosis. In the same year, this disease killed almost 2 million people. Tuberculosis in general is subject to socially vulnerable groups of population. Therefore, this disease is most common in the regions with unfavorable economic and housing conditions. Thus, in 2016, 7 countries accounted for 64% of infections.
TB is the biggest killer of all infectious diseases in the world. TB kills 1.5 million people every year and makes 9 million people sick. Here in Kazakhstan, it kills up to 600 people per year. So that's almost 2 people a day dying every day in Kazakhstan from TB.
Lack of nutrition and sanitation are the main reasons for the spread of tuberculosis, experts say. The abuse of tobacco and alcohol significantly increases the chances of getting sick. Also, people with immune system disorders are at the high risk.
Well,
I must say that in 2014, the World Assembly of WHO in Geneva adopted the strategy on the fight against tuberculosis in the world for the period of 2015-2035. There, the main goal is outlined to eliminate the epidemic of tuberculosis worldwide. There are also target goals which we must achieve, like the decrease of morbidity by 95% and mortality by 90%. Today, experts confidently state that tuberculosis can be successfully treated even at the late stages of the disease. But often, people are simply not aware of existing programs and methods of treatment. And this is the main problem for many countries.
A lot of people are afraid to get tested for TB because they think they're going to die. They're afraid what their neighbors are going to find out. This is what we call stigma. But there is no reason to be afraid of TB. TB does not know any borders. It attacks you if you're poor, if you're rich, if you're a man or a woman. But what's important to know is TB is curable. We have the drugs, we have the ability to cure TB.
New drugs to fight tuberculosis haven't appeared for 40 years, and only in the past few years an American pharmaceutical company released the new bedaquiline medication, which has beat a path to a world without tuberculosis.
Well, our first and most important partner is the government of Kazakhstan. We work very closely with the Minister of Health and the National TB Program, as well as the Republican AIDS Center. You know, TB and HIV often go hand in hand, and so we work very closely with them.
Specialists of the National Scientific Center of Pulmonology of Kazakhstan note positive changes achieved due to, among other things, participation in international programs. We have achieved high indicators in the reduction of morbidity and mortality rates, the number of cases of infection and the number of people died. And in this part, of course, any methodologies that are newly developed in the world, proven from the point of evidentiary medicine, are successfully introduced in all regions of Kazakhstan. Training programs for Kazakh specialists are a separate chapter of international cooperation. This allows domestic doctors applying locally the technologies and practices developed far abroad. A grant from the Global Fund is being implemented in our country, according to which a number of trainings are being held here. Among them there are a laboratory diagnosis using new molecular genetic methods, individual and short-term treatment regimens, and active pharmacovigilance, which is something new for our doctors. International experts, for their part, also note the work done by Kazakhstan organizations. State and non-governmental associations conduct research and inform the society about the signs of disease and the ways of treatment. We've conducted a survey among Kazakhstan residents trying to find out whether they know how to protect themselves from tuberculosis. And that's what they responded.
Надо проходить обследование, рентген, флюорографию. Регулярно это делать, раз в год хотя бы.
Ой, я не знаю.
В общественных местах надо одевать маску.
Но самое главное – это не курить.
Лучшей профилактикой на сегодняшний день является прохождение регулярной флюорографии.
Tuberculosis germ, like many other bacteria, has the property of mutating and becoming drug-resistant. This can happen for a number of reasons. Wrong treatment is one of them. This cartridge replaces 3 large rooms that we directly need for PCR diagnostics. Since it is a closed system, only in 2 hours we can learn whether a given patient has tuberculosis and whether it is a multi-drug resistant type of it. Identification of multi-drug resistance is the second function of GeneXpert apparatus. If this form is revealed, the patient will have to undergo longer and harsher treatment. Here is the actual picture by which the sputum sample with the patient's name and the laboratory number was processed. We can get the results on the screen. I can show you the results of a patient. If he or she has tuberculosis, the red indicator lights on. We see that this patient is diagnosed with tuberculosis and that he or she has a multi-resistant form. This means that we should use second-line drugs for treatment. Multi-drug resistant tuberculosis is a form of disease caused by a bacterium that does not react to at least azoniazid and rifampicin, the 2 most powerful first-line anti-tuberculosis drugs. Therefore, the treatment of this form of the disease will not only take more time but also requires intervention of drugs with high toxicity. In Europe, the growth of tuberculosis has fallen to the beginning of a new century and was associated by some experts with a huge wave of migrants. States began introducing special regimes for foreigners, but such measures did not give any significant changes. According to the assurances of the medical community, the reason for this is that in the second half of the 20th century, in the old country, indicators consistently showed a decrease in the number of diseases, and tuberculosis began to be called disease of the past. This led to a decrease in attention towards tuberculosis from the governments. Physiology as a scientific discipline has become only a section of pulmonology, and many specialized anti-tuberculosis institutions were completely eliminated. The first International Congress on Tuberculosis was held in 1867 in Paris. In 1920, the International Union Against Tuberculosis was established here. Today, 114 countries are the members of this organization. Several important dates can be attributed to the main milestones in the history of tuberculosis. In 1919, a vaccine was created which was called the Bacillus of Calmette-Guerin, or BCG. In 1943, American biochemists received streptomycin, the first anti-tuberculosis drug. Since 1946, the World Health Organization has joined the fight against tuberculosis. In 1993, it declared tuberculosis a global problem and introduced the DOTS strategy. Both BCG vaccine and the DOTS program cause a lot of controversy among the society and among specialists. However, WHO experts are serious about fighting TB. In May 2014, the Global Strategy on Tuberculosis till 2035 was approved at the Palace of Nations in Geneva. The resolution calls on governments to ensure a high level of support and financing of anti-tuberculosis programs. Particular attention in the strategy is paid to serving populations with increased vulnerability to infection and with limited access to health care. In Kazakhstan, treatment, diagnosis and prevention of tuberculosis are included in the list of guaranteed medical care funded by the state. Any patient can independently choose appropriate medical institution throughout the country. The effectiveness of treatment of a drug-resistant form of tuberculosis in Kazakhstan is 75%, which is one of the highest in the world. And this allows us quicker identify tuberculosis, effectively cure it, and frequently reduce transmission of the disease. One of the important points that the patient needs to know is that today there is no need to conduct the entire course of treatment in a hospital. Experts claim that if the condition of patient's health does not require round-the-clock surveillance and the patient does not pose a great danger to others, he or she can be treated at home.
And Kazakhstan is also leading the way in shortened treatment regimens. As I mentioned before, it usually takes about 2 years to treat drug-resistant TB, but Kazakhstan is starting a new program that for some people they can treat the drug-resistant TB in 9 to 10 months. That means in 9 to 10 months people get their lives back. They get back to work. They can be much more involved in their society. So there are so many exciting things that are happening right now in Kazakhstan.
Another innovation that doctors practice is communication with the patient via the internet. If the patient does not have the opportunity to get to the medical facility, he or she can be consulted through video chat. Today we can say that all anti-tuberculosis activities in Kazakhstan are carried out within the 2 state programs, Densaolek and a comprehensive plan to combat tuberculosis, designed for 20 years. It describes all activities and kinds of examinations. And for today, it is completely financed at the expense of the state. These programs, as well as methods of diagnostics and drugs, operate in every TB dispensary of the country, and doctors receive necessary clinical guidelines how to diagnose and treat tuberculosis using modern methods. We have a training center where we have special instructors who have passed special training for coaches. Hence, in different areas of physiology, working programs, training programs have been prepared. Various situational tasks and tests have been conducted. That is, our specialists are commissioned on request from the regions to conduct training in different directions. Specialists of the National Center of Physiopulmonology teach TB doctors, conduct training on infection control and on topical issues of pediatric tuberculosis. In addition, there are recommendations for the treatment of extrapulmonary forms and surgical intervention. There is a block of trainings on laboratory diagnostics.
In 2017,
our center has trained nearly 3,000 people. Most of them are doctors of the primary healthcare network and staff of anti-tuberculosis organizations. Training is carried out by the staff of the penitentiary system. That is, we target all specialists, starting from diagnostics specialists and outpatient treatment. Of course, one of the challenges for a sick person is his or her limited ability to work. Disease is costly itself, but where to get money without the ability to work? Some of these difficulties are trying to be solved at the local level. For the period of treatment, patients are provided with sick leaves. That is, pages of so-called temporary incapacity for work. After the expiration, and the treatment regimens are quite long for tuberculosis, they can be assigned to different disability groups. In parallel, by means of local authorities, Archimats, at our outpatient stage, 70% of patients today receive social benefits of cash payments. Meanwhile, the number of patients with tuberculosis in the past 10 years in the country has decreased almost twice, from 30 to 16,000. Today we can say that in Kazakhstan significant positive changes have been achieved in the fight against tuberculosis. I can name two of them, which are the most indicative. The incidence of tuberculosis has decreased 2.5 times in the last 10 years, and the death rate decreased sixfold. Almost every third person in the world has tuberculosis bacillus, and although the disease develops only in a small number of infected people, the fight against this disease remains an urgent problem for all mankind. The fact that there are separate hospitals for tuberculosis treatment proves the scale and complexity of the fight against the disease. The global nature of the problem is also confirmed by numerous WHO studies. In the next 15 years, countries need to intensify efforts to prevent, detect and treat this disease, experts say. Only by combining efforts and raising attention to this source of human ills, we achieve our goals on complete eradication of tuberculosis by 2030.